Safety is the most important thing. Not being out of work, going right back to work, not starting major anesthesia. All this cuts the risk. So there are two things that we should have in mind in the procedure that we do. Most important one is safety, and that's what Dr. Ilkani and I have created over the last 30 years. Number two is the outcome, the result. So if the patient wants, most patients, 80-90%, they want the major veins to go away. And the procedure we do does that. A few patients, if they want all the spiders go away, they can talk to us. We can get rid of them progressively also and get rid of the spider. But patients should ask for that and should want that. But the procedure has to be very safe no matter what you do. And that's the aim of our procedures, basically.
Our unique advantage, actually comparing to some other places, is that we are vascular surgeons and we can do all spectrum of the treatment, from surgery to the injection, from mild invasion to no invasion. Well, the patients, as we said during the talk, that they may find themselves, they see the veins, their parents have that vein, the sister had it, the family had it. So those are, they can come for the consultation. And the patients that they have swelling, ache, cramps, and discomfort, especially heat and throbbing in the leg, they could come for a consultation. And those patients, we consult them. If they have a problem, we offer them the type of treatment that they require. And so the patients can find them that way.
So some patients have obvious veins. They can see it and they know that they have varicose veins. A lot of patients do not see it very well. They're just spider veins. Spider veins, if you have a lot of spiders, always come from varicose veins. But varicose vein could be small, causing a lot of spiders because of your genetics. Could be big veins causing a few spiders. Patients have swelling in the leg, so the veins are hidden underneath the swollen leg. They have aching, cramp, swelling, but they actually have varicose veins causing that. But because of swelling, they may not see it very well. So the best thing, as Dr. Ilkani has mentioned, is if you feel those, if you feel aching, cramp, pain, aching, or you have a spider, to seek advice and to see that what can be done. And then you decide what to do.
And one of the symptoms that spider vein especially have a lot of people complaining of is itching. They have an itching in the leg and it's very annoying and uncomfortable.
The spider veins are called devil's pinch. Actually, that's a medical term. Because when you have a lot of spider, they say it itches a lot or it irritates. Dr. Khan mentioned. That's because it irritates the sensory nerves. So when you get rid of it, that goes away also. So spider veins usually do not cause any symptom, but sometimes they cause those kind of burning sensation or itching.
Is that free to?
No,
not yet. Okay. Another one.
Free.
And just Chinese like to know the
No,
thing.
you need to have insurance. There's no free one.
Maybe
even the check, even for the check, they charge, right?
Yeah.
Maybe it should be mentioned. It should be mentioned. Maybe that.
That attract more
deal
patients.
with most insurances.
Yes.
That maybe should be mentioned in the video.
Yeah.
I'm sure.
Yes, we do. Is the place taking most of the insurances? Yes.
Between two of us, we accept more than 90% of the insurances.
Do you accept New York Medicare medical insurance as well?
Yes.
Yes.
We take Medicare.
The place is very new and is progressing very well, and I think we can serve the community very well at this area.
Our patients come from various places, some of them from far areas, and it depends on what they want. If they want to have just the major veins to be treated, we can do it. If they want every little thing to be done, diethyl and I can do it also. The medical part, and there is a cosmetic part. We can achieve both if the patient decides to have those. A lot of them say, just the big veins, I don't care about the little spiders. Some, especially younger women, they want the spider veins to go away also. We can do that as well.